Welcome to Discover Midwives, the podcast where we explore the art, science, and impact of midwifery. I'm Jessica Brumley, and each episode we'll uncover the stories, the history, and the expertise of midwives. This is your space to learn, connect, and celebrate the power of midwifery. Let's discover midwives together. Welcome to Discover Midwives. This week, we're going to talk about what is probably the most common topic of conversation once we hit the third trimester: pain in labor. And I think it's really important that we recognize that pain in labor is probably one of the most misunderstood experiences in healthcare. And we spend so much time teaching people to fear pain in labor in our society, in our culture, but we don't spend very much time helping people understand what's happening. And we know that pain in labor is real, but in midwifery, we help people to understand how their body really works. And although pain is part of labor, suffering does not need to be part of labor. And this, I think, is a very important distinction. This topic is really critical, and I think it's what brings a lot of people to midwifery, is the kind of support that you can get and the kind of advocacy and education that a midwife brings to one's labor experience. So let's start with, what is labor pain, and how is it different? Because we experience pain from a very young age, and usually that pain signifies something bad, something negative, like I touch my hand to something hot, and I'm going to immediately flinch back because I don't want to burn my skin, right? That's bad in my mind, and I want to pull away from the pain. But in labor, pain signifies a normal physiologic process. It signifies the work that the body is doing. Contractions are the uterus working effectively. And pain with contractions can equal cervical change, fetal descent, stretching and opening up and accommodating your baby through the birth canal. There are a few different stages of labor, and how we experience them can be very different. And I will say, everyone's experience is unique. Even one person's, labor with their first child versus their second versus their third, right? Each of those experiences are totally unique. But in general, the early stages or the latent phase of labor involves cramping, backache. There's these sort of like waves of cramping that come and go, often in an irregular fashion. And then there's active labor. And active labor is when we're seeing more consistent change in the cervix, and the contractions build in intensity and frequency. There's more of a rhythm with inactive labor, and they're more consuming of our energy and our effort. It takes more focus to get through each contraction. And then there is this phase of active labor that we call transition. And in transition, the intensity really peaks. And it is this like portal into motherhood, right? You are about to get there. Almost everyone says that, I can't do it. anymore when they're in transition. It is this super intense, part of labor. And some people say, that's right, you can't do it anymore. You can't be this person anymore because you're about to be someone different. You're about to be a mother. You're about to be a parent. You are about to change and bring forth life. And then the pushing phase. And the pushing phase is also very different. Contractions may be just as intense, but now the head is lower and we feel pressure in a different way. And oftentimes, when people start the work of pushing, right, the pain is different. It all of a sudden feels like I can do this because I have this work, right, to do with it. The pushing changes the experience, but we also start to experience stretching and and an intense urge to bear down, right? I mean, sometimes it's so intense you couldn't stop if you tried, right? It's baby's just coming and I have to push. And so each of these phases can really be a very different experience. And I think it's important to recognize that there's a lot that can impact that experience. And if someone is up all night in early labor, can't sleep, right? Gets into active labor after being awake for 24, 36 hours, that active phase of labor is going to be a very different experience, right? As compared to someone who slept great, woke up and had a short early labor, went right into active labor. That's a very different experience. Someone who's well supported, someone who feels comfortable in their environment, all of that can impact your experience. Any past traumas, and even our own um, cultural nuances, right? In some cultures, it is expected that you be very vocal in labor, and that suffering is part of one's transition, into motherhood or parenting. Uh, and in others, a very stoic, laboring person is expected. So all of that can impact how one experiences labor and pain in labor. Um, Two people can have the exact same contraction pattern and experience labor completely differently. There's no one right way to labor. And there's something that we call the fear, tension, pain cycle. And this is really us understanding how we're feeling impacts the physiology of labor and birth. And so when someone is afraid, it builds tension, and that tension builds pain. So tension increases our perception of pain, in part because of the hormonal impact, right? Adrenaline, fear can increase adrenaline, and adrenaline can increase muscle tension. So it's often where I see people's shoulders, right, are way up near their ears, and this is a sign of tension. This is them holding it in. And so you'll have an increase in intensity of your contraction if you're feeling afraid. And hormones really matter. We know that because oxytocin, right, is known as the hormone of love. A synthetic version of it, right, is given in order to induce labor. And oxytocin supports contractions. It also supports bonding with the baby. Endorphins are our body's natural pain relief. They're like natural opioids. And so when we have a spontaneous labor, you have oxytocin and endorphins surging when things are going optimally. And this balance helps us with a coping in labor. And we know that when someone feels safe, that can influence the release of both of these hormones. So environments where people feel comfortable, where they feel safe and nurtured, can help to can help the release of these hormones. But the reverse is also true, right? If there's like bright lights and lots of interruptions and a lack of privacy, and if you feel like you're being watched or judged in some way, then that may inhibit the release of your oxytocin or your endorphins, causing a more intense experience. And so in environments where you feel supported will help you to have a more physiologic labor and birth. And this experience is not just emotional, it's physiologic, right? This is the physiology of labor and birth. And it helps us to be able to cope with pain. And I like this idea of coping. Oftentimes, when we're measuring pain in any other setting, we ask people 0 to 10, right? 0, no pain at all. 10, you feel like the worst pain of your life. How's your pain right now? And that number can be anywhere on the spectrum, and you can be coping well or not be coping well. And there is this coping scale or that a coping algorithm that we'll often use in labor to really get a better assessment of an individual's experience, because pain is expected. And I might very calmly sit here and say, I'm having a pain that's 10 out of 10, but I'm doing okay. This is labor, this is birth, and we're going to get through this, right? And someone else might say, I'm having pain 10 out of 10 and I need your help. And they're trembling and they're tense, and they feel like that they need help. And what's most important is that the person gets what they need, whether that's supporting them through that pain 10 out of 10 and keeping on going, or getting some kind of relief because that's what they're saying that they need. Not not coping doesn't mean that you're failing, right? It means that you need support. And wanting pain medication is not weakness, right? That is communicating your needs. And unmedicated birth can be an amazing experience, or it can be totally traumatic for someone if that wasn't what they want or not what they needed in that moment. And so I think it's important for us to reframe what success looks like, right? Because success, in my mind, is that someone has informed choices, that they feel supported throughout their entire experience. Not whether they have an epidural or don't have an epidural, but that they get what they need and they want, and they're supported throughout that process. And I think it's really important that these choices, again, be informed. So we think about, what are all of our options? Am I being presented them? Do I have that as, do I have access to all of my options? And am I being supported through that? So there are several non-pharmacologic coping tools that we can talk about. One of the easiest is movement, right? Sometimes people say, well, if I go walking, will that make me go into labor? I mean, if that was the case, every nurse and midwife and doctor I know that works in the hospital would have a preterm delivery. No, walking isn't going to put someone into, labor. But walking does help with coping in labor, right? So when someone comes in and they're not sure, they think they're in labor and they want to go for a walk, it's more about just like keeping them comfortable while they're contracting, because movement helps you find your rhythm. I also love hydrotherapy. Access to water is so amazing in labor. That water submersion in a tub, or feeling the water is like a light massage in a shower. Hydrotherapy is something that we almost feel called to when we're in labor. The water feels so amazing. We talk about breathing. Right. Historically in Lamaze classes, we would teach this like patterned, breathing. And what we know is that there's no one right way to breathe in labor, but doing guided breathing and completing practicing of breathing during your pregnancy can really help you to keep that up in labor, help you to focus and stay relaxed. And so that's an amazing tool as well. And then touch can be a really powerful tool in lots of different ways. It can be a really light touch. It can be a firm touch, such as counter pressure. We often like to put counter pressure against somebody's back when they're having intense back contractions, and so they can even control the intensity of it by leaning into that counter pressure of my hand on their back. And then massage. It can be deep muscle massage. It can be a lighter sort of like called effleurage. It's sort of like a lighter stroking movement. All of that can feel really great. How we use our voice vocalization. I often guide people through um, uh, using their voice sort of deeper. So if you're going to make a sound, make it low and deep, as opposed to high pitched, right? Because if we're using a high pitched vocalization, we tend to have our shoulders up high and tension builds. Whereas if you're going like I call it like the labor moo, ooh, right, like down low, that feels really good, and it helps to help keep our body open for labor. We know that continuous support in labor is an amazing coping tool, whether that's continuous support from a doula, from a nurse, from your loved one, whoever your planned support is. You should be able to have that, but in continuous fashion throughout your labor and birth, help you to have a better experience. And we know the evidence shows helps to improve outcomes like lower C-section rates. And so that's a really powerful tool for coping. We also recommend for people who are having a low risk labor and birth experience, intermittent auscultation of your baby's heart rate allows you to be up and moving around, and so having that option at wherever you're birthing can be really helpful. And in general, the opportunity to eat and drink, you know, as you see fit. And so usually in early labor, this, is a little bit more frequent. You're probably going to feel hungry and thirsty and you're eat and drink. And as things get more active, maybe you feel that a little bit less. Sometimes people develop nausea in the more active phase of labor. And so having lighter drinks and snacks just to keep your energy up is a helpful coping tool. And all of this is evidence based, and we know that when we have the opportunity to use these tools, that not only do we have a better outcome, so like less likely to have a C-section, less likely to have an episiotomy, but also we feel better about the experience, and we feel more satisfied. And I like to say that experience is an outcome that we need to be measuring, that is just as important as the other outcomes that we're often talking about and studying. So those are a lot of the non-pharmacologic opportunities or tools that we have to help support coping in labor. But also it's important for us to understand that depending on where we're birthing, we may have medication options available to us as well. And so knowing what options are available at your birthing facility is important. And at my own hospital, I have both nitrous oxide available, IV narcotics, such as fentanyl or morphine, depending on the stage of labor, and an epidural. And all of these can be really powerful tools when used through a process of shared decision making. And so, for instance, nitrous oxide is also known as laughing gas. It's very short acting, and provides a little bit of a decreased anxiety, and so a little bit of relaxation. It can just help somebody kind of get through the most intense part of the contraction. And usually it can take 5, 6, sometimes 7, 8, or 9 breaths before it really takes effect. But it can just kind of help you get through that peak of the contraction. And once you take it away from your face, it wears off in 30 to 60 seconds. So this is great for someone who really wants to still be up and moving around, and still have all of those options. Um, some people have a little bit of a side effect of nausea associated with it. And so that's one nice option. I mentioned the IV narcotics, such as fentanyl or morphine, in the early stage of labor. If somebody's having a really long early labor, sometimes something more long acting like morphine can provide some therapeutic rest, can literally just knock you out and put you to sleep for a couple of hours. And when we use it as part of a therapeutic rest protocol, 50% of people who are in this like early phase of labor will wake up in active labor. And so it can be a really great tool to just kind of cut the pain, get some rest, and then either you're in active labor when you wake up or you're not. And if you're in active labor, fantastic. And if you're not, then we'll come up with another plan, but at least you've gotten some rest. And rest can really help to mitigate, right, the chance of exhaustion in a long labor. And then I mentioned fentanyl, and fentanyl is shorter acting, but extremely effective when used in active labor. Great because we see less side effects on the baby when the baby's born, because we know that narcotics can lead to respiratory depression. So the baby just kind of not breathing as we would like to see. And we can be prepared for that when the baby's born, to help to mitigate those risks. But that can be a very powerful tool. And some people use that just to kind of get them over a hump. And then some people use that even to bridge them to an epidural. Maybe they've gotten to a point where they decided they want an epidural, but they need something faster. And so that can be a useful tool to bridge them to an epidural as well. Shorter acting options can also be nice if you're having an induction of labor, or some kind of procedure, and it's happening, and you just need a little something to cover you for a painful procedure or an exam in labor. And then the epidural is anesthesia, which means that you have to have an anesthesia provider place this epidural catheter. And for most people, it provides the most complete relief from the pain, and it can numb you from your waist down, meaning that you're going to be in bed. And for some people, that's not something that they like, and for other people, it is finally an opportunity to get some rest after a very long early labor or very long active labor. Epidurals can be transformative and appropriate when someone is having a hard time coping, and their labor is working, their body is working really hard, and they haven't made any change in their cervix. The epidural can be therapeutic, and sometimes can save us from going to the operating room. And so it can be a very powerful tool. What I think is most important is that we use a process of shared decision making. And it's important that people receive accurate information and counseling. And we shouldn't be using fear-based messaging, right? It shouldn't be about scaring you into making a decision either way, right? Risks, benefits, side effects. That's the information that you need. You you can prepare for one kind of birth and still make a different choice in labor. You can prepare for a home birth and then at some point decide, actually, I'm going to need a different kind of support and transfer to the hospital. And that's not a failure. Um, and and that those kinds of experiences, that that can also be associated with a certain kind of emotional pain. Labor is intensely emotional, not just physical. And I think actually most people underestimate the amount of emotional support that they are going to need in labor. Right? We often talk about the physical discomforts of labor, but labor can bring up a lot of fear, past birth trauma, or other trauma that someone might have experienced, right? Um, the fear of loss of control. I remember one time a patient shared with me she had birthed in another country, and the first time, and she had been scolded for having a bowel movement while pushing. Now, anybody who does birth work knows that is completely normal. I mean, we see it regularly. We expect it. We actually kind of get excited when it happens because that means that somebody's pushing really effectively. And absolutely can understand why people feel a little bit, a little bit uncomfortable about it. But we're going to try and make someone feel as comfortable as possible. That's what support, right, in labor looks like. But since she was scolded in labor by her care provider last time, I thought to myself, oh, wow, we've got to work through this. We've got to have this conversation because she's probably not even going to want to push when it comes to pushing out her next baby because of that trauma, of that experience the first time around. And at no point should anyone feel unheard, right? The birthing person's voice should be the center of the room. And so, it's really important that we are in tune to the emotional needs of the laboring person, and that we think about how we're using our language to support that person, right? If your cervix isn't dilating as we would expect, right? I think it's important to acknowledge that your body is working really hard, right? And not that you're just like not progressing, or it's important to present things as options if they really are options, and almost always are they truly options, right? I'm never going to tell somebody what they have to do. I may make a recommendation because that's why you come to me, right? Is for my expertise, right? But at the end of the day, I'm not the one who has to make the decision. I'm the one who has to support you through making those decisions. And consent is critical, right? That's part of us providing trauma informed care, right? Recognizing that we are here both to provide care for someone who may have had trauma, and also to provide care that prevents any future trauma. And consent is part of that process. You know, if I'm even going to, begin to touch you, I might pause and say, is it okay if I feel your belly? Is it okay if I um, check and see what position your baby is in? And I should be explaining why I even, want to, to do this. It should be a process of consent and education and information, creating what feels like a really emotionally safe environment where it is absolutely fine for that person to say no at any point. And they know that, and they feel that, and they feel that their team is there to support them. People may not remember your name, but they absolutely are going to remember how you treat them during labor. And anyone who's ever met anyone who's birthed a baby knows that they remember their birth stories for the rest of their lives. right? You can talk to your grandmother or great grandmother about their births, and they will remember them because they're such powerful experiences. And how someone is cared for in labor is really so critical. And so we know that the kinds of things that people need in labor is a calm reassurance, continuous support, honest, open communication, and the kind of support that makes someone feel like they have the capacity to make the decisions, to get through this process. Um, Language that you might want to hear is things like, "You're safe," right? You're doing an amazing job. Uh, this contraction will end one contraction at a time, right? You're doing such meaningful work. And maybe you know the kinds of language you want to hear. Some people will use affirmations in their room. They'll have these powerful statements that they put up in their space, so that when they look around, they can read that language, and helps them to feel safe and remind them of just how powerful that they are. And you want to surround yourself with people who will support you, but also recognize that the decisions that you made before labor and birth, that you may change, and that this is a flexible experience, and that they're going to support you, whatever your decision is in that moment. Yeah. Um, so I think it's really important that we start to reframe labor, uh, instead of only focusing on the pain. We talk about how this intense experience is transformative, and labor can be unpredictable, and it is the most human of human experiences. It is literally the foundation of our humanity. Um, we we need to start shifting the narrative on labor and birth and pain. We don't want to romanticize what labor looks like, right? I don't think that does anybody any service. I don't think we should make it seem like it's easy, or that labor can be, or labor is only easy and peaceful, because that's not everyone's experience. But labor is always powerful. Birth is always powerful. And that, I think, is really important for us to recognize, and that we can be powerful in birth as well, regardless of what our choices are. Um, so this is the kind of care that everyone deserves. And I hope that you've learned something today about pain in labor, about what support can look like, what coping looks like, and maybe something about how you can prepare for labor and birth. Right? Take a class, bring a friend, engage with a midwife, engage with a doula. Really think about who's going to be on your team, to support you. The goal here is not winning at birth, right? But the goal is emerging from birth feeling safe, respected, and supported. And so often these days, I feel like people just want to survive, because there's a lot of fear that's out there. There's a lot of fear around maternal morbidity and mortalities, sickness, injury, death associated with pregnancy and birth. But uh, you know, surviving shouldn't be the goal, right? That should be the expectation. And what I hope for everyone is that they have an experience where they feel safe and supported and surrounded by love. And I think that's what every birthing person deserves. So as we wrap up, I want to leave you with this. You deserve care that listens to you, respects you, and includes you in every decision about your body. And if something in today's episode resonated with you, I encourage you to write it down, talk with someone that you trust about it, or bring it with you to your next healthcare visit. Information is powerful, but using it is where change begins. If you found this episode helpful, you can follow us or subscribe wherever you listen to podcasts. Sharing this episode helps more people learn about their options and what respectful maternity care looks like. Thank you for spending this time with me. Take good care of yourself, and I'll meet you back here next time. Discover Midwives was brought to you by the American College of Nurse Midwives. To find a midwife in your community, go to midwife.org.